Hi, Zeke. Good to see you again.
Nice to be here.
Good. Tell us why you wrote this book.
Well, as I say in the acknowledgments, a reporter from the New York Times called me up when she was switched over from foreign affairs to public health and said, would I talk to her about the American healthcare system and explain to her the American healthcare system, and she wanted to know if we could meet for tea. And it was like, well, that's a bit ridiculous, right? You can't explain the American healthcare system in an hour. And I said, at that time, I sort of said to myself, wouldn't it be nice if there were a 250-page book I could just give to someone and that would explain the system? And when you look out there, there's no such book. And I always figured the reason is if you're a tenured professor or a tenured health policy person, it's beneath you to write the book explaining the system. And if you're untenured trying to get tenure, you figure you write this book, you're never going to get tenure because the tenured people. So I wanted to fill that void. And then once I got into writing the book, I began to think, well, you know, it sets the platform for what's going to happen. Why don't I start making predictions about the future from what I know and all the people I've talked to? And I had been trained well enough because one of my colleagues at Penn is a guy named Phil Tetlock, who's a professor at Wharton, and he's done a lot of research about forecasting and making predictions, and he warns you that it's a bad idea because mostly experts don't do so well. Nonetheless, we all have to make predictions, whether we're running hospitals or doctors or investors, and so I did my best on the predictions.
Okay. Well, a lot of people know you as one of the architects of the ACA, Affordable Care Act, otherwise known as Obamacare. But before we talk about that, how did you even get to become an architect? What was your path? And let's just start with medical school and maybe telescope
us. It's a long path.
It's
It's pretty circuitous. So I was in medical school and not very happy about what I saw around medical school, that we were failing. And one of the most frustrating aspects of it is when I would work in the emergency room as a student and see, we took care of this patient who had, say, heart failure, difficulty breathing, admitted to the hospital. We worked hard to make sure that patient was what we call dried out. The excess fluid was taken down, on the right medications, everything was tuned up perfectly, discharged the patient home, and inevitably he or she came back 6, 7, 10 days later, and we had to do it all over again. And that we were not following up. I similarly remember one patient who was in the hospital for 6 weeks for bacterial endocarditis, sent the patient home, and literally 2 weeks later, back in for the same endocarditis. And it just wasn't good, and it was extremely frustrating. I also then went to do a PhD in political theory at Harvard, thinking that I would that some of this was sort of the values of the healthcare system. And so I worked on end-of-life care, the physician-patient relationship for a while. Then I came to the NIH and I worked on research ethics. And as I was seeing the end of, after about 7 years, seeing the end of that, I decided I should turn my attention to resource allocation in the healthcare system. And I had the good fortune of teaming up with a very prominent health economist from Stanford, Vic Fuchs. And when everyone in health policy was sort of depressed about there's going to be no comprehensive reform, Vic and I were thinking, all right, well, what would the comprehensive reform we would want to have? And we developed a voucher-based system, and that sort of got me into thinking much more about health policy. And then when President Obama won, and he appointed Peter Orszag as head of the Office of Management and Budget, I knew Peter from a lot of conferences and meetings, and I emailed him and I said, Peter, do you need a doctor to help on healthcare reform? And he said, let's talk. We talked that afternoon and worked out an arrangement where I would work at OMB assisting.
Okay. And as far as the problems with the ACA, which you devote perhaps the first half of the book to, that you set out to fix, you collectively, can you outline those?
Well, the American healthcare system, as I say in the subtitle, is terribly complex.
Right. Here, let's read this, okay? How the Affordable Care Act will improve our terribly complex, blatantly unjust, outrageously expensive, grossly inefficient, and error-prone system.
Right. So I think, the healthcare system in 2008, 2009, before we reformed it, was all those things. It was incredibly complex, still trying to explain to people just how it's paid for through insurance, through Medicare, Medicaid, the VA. I mean, it takes about 40 pages, and I don't even go into all the details. Then you explain how doctors are paid, how hospitals are paid, what the incentive structure is, what the regulation for drugs is, for devices. All of that is incredibly complex. And we weren't doing well. I mean, by any metric, 50 million people were uninsured. We had uneven quality. Some of our great academic centers are fantastic, outstanding quality, the world's envy, but pretty uneven. We have millions of people who have high blood pressure, not hard to diagnose, not hard to treat, who are either not diagnosed or inadequately treated, and we know that increases your risk of stroke, of heart disease, shortens your life, and that's full of the system. Before we passed the Affordable Care Act, 1 in 20 people going into the hospital got a hospital-acquired infection. Tens of thousands of people died. And then there was the cost, taking ever more of the economy, making states trade off between Medicaid and education, making individuals get health insurance but keeping wages low. Lots of reasons to change the system. And I explain all of those. And I think, any one of them would be good enough justification. Having all of them, I don't think there was a Republican or a Democrat in the world in 2008 or 9 who really understood the system, who would say, oh no, it's great. I mean, really by 2008, 2009, almost everyone had agreed we had a system that was broken and needed repair. And the question just was, what kind of repair?
Right. And you explained that very, very clearly. I mean, this is
healthcare.
The healthcare system is a daunting enterprise, and it's incredibly clear. And what's also very interesting in the beginning is the history. Now, I guess you could go way back, but why don't you just start with Nixon and work way up to Clinton?
Well, one of the surprises is I decided to let's give people a feel for how long we've been trying to change the system. It does go back to 1912, but one of the surprises to me is to uncover how engaged Republicans were in healthcare reform. In 1945, the governor of California at that time, Earl Warren, a Republican, pretty conservative, proposed comprehensive healthcare reform for California. And he came within one vote of getting it passed in California. And he had gotten sick, and he said, we really need to protect people from the cost of getting sick. When Nixon got elected in 1946 to Congress, one of his first legislative bills he introduced was a bill about comprehensive healthcare reform. And here's the crazy thing. If I describe it to you, you'll think, man, did he write Obamacare? Was he one of the architects? He wanted to give people subsidies based upon their income so that they could go and buy private insurance to cover themselves. And the government would provide those subsidies. Sounds a lot like Obamacare to me. He proposed that in the late 1940s. And then when he was running for president in 1960 against John Kennedy, there was a big debate. Both the Republicans and Democrats were trying to figure out how to get those people left out of the employer-based insurance scheme, poor people, especially the elderly, how to get them insurance. And he, again, reintroduced this idea of subsidies for people to buy private insurance. And then when he gets president in 1973 and 4, he's negotiating as president with Ted Kennedy in the Senate and Wilbur Mills in the House about how to come together on a comprehensive health care reform bill. And they were this close to a bill that they could agree to. And then, in typical Washington Washington arrangements, scandals break out. Wilbur Mills has the Fannie Fox scandal, where an exotic dancer falls into the tidal basin. He's disgraced, and he's forced off the chairmanship of the Ways and Means Committee. Watergate overtakes Nixon, and it all goes poof. And actually, we also need to say that liberals and unions at that time did not want to have a deal that would have private insurance continued. They wanted single payer, and they were resistant to Kennedy and Mills making a deal with Nixon, and they withheld their support. So you've got a combination of scandals, which mainly put the kibosh on this bipartisan agreement, with the unions and liberals opposing it. And for 20 years after that, until Bill Clinton, we didn't have another reform. And then Clinton comes in and wants a sort of market-based reform, proposes his Health Security Act, and unfortunately there are lots of other things overtook single focus on it. He had to pass a tax increase. They had the NAFTA bill. By the time all the rest of the stage was cleared for health care, opposition had gained and had defeated the bill. You didn't even get one bill passed out of committee. Healthcare reform's dead for 15 more years until 2008, and the